like to tell a little bit of stories and things that's happened along the way. I originally started out with the Department of Human Services in another state. After that, I worked about 10 years in medical equipment billing. I did AR consulting for 10 years, and I've been with, and then I went to mental health for 15 years with the state. And now I've been with Central Minnesota Council on Aging for about 8.5 years. And I can see people calculating my age out there. So I just want to tell you that when I came to Central Minnesota Council on Aging, I thought, well, this is going to be a breeze. I know Medicare, I know HMOs, I know PPOs, I know all this. I was overwhelmed. So when people come up to me and say Medicare is confusing, I agree, Medicare is confusing. So we're trying to change that. I know there's been some laws passed, there's some things happening, but we want you to know. I just want to give you the information, and really our job at Senior Linkage is not to advise you, it's really just to educate you so you can make your own informed decision. So you know who I am, and you know a little bit about Senior Linkage Line. How many people have heard of us? It's important for me to know. Oh, good to know. Tell friends and neighbors we're a free resource line for seniors. I always say for seniors and anybody that knows one. So that pretty much encompasses everybody. We don't recommend one provider over another. We just basically give you information so you can make your own informed choice. There's some ways that you can contact with us. You can call us. We're available to meet in certain areas. I happen to be the outreach specialist for several counties around us, especially for Chisago. So I certainly would meet with somebody in person if they were having difficulty just making that decision and just educating them more about the plan choices. You can chat with us, and you can go online. I want everybody to know about the referral online. This started several years ago. You can make a referral to us online. It's really a great way because we had a lot of people call us and say, my neighbor really could use some help. Could you call him? We can't make cold calls. So this is a way for you to recommend, refer somebody, to go online, and then we'd be happy. When we get that referral, we'd be happy to call that person for you. And it's just talking a little bit more about Senior Linkage Line. You can sign up for emails, and this is how. You can get publications like the Healthcare Choices. This is just the Senior Linkage site. And here's where you can sign up for emails. Sorry, got ahead of myself. The Healthcare Choices Guide is a publication. Under the Board of Aging is the Senior Linkage Line. This comes out every year. It has every plan offered in the state of Minnesota. The plans are offered by county, so you do have to look through the book, and it's not quite as thick as this one because I have it in sleeves, but we refer to this as our Bible. It really has so much information about the plans. People look forward to this coming out every year. We used to be able to send it in the mail. No longer can we do that, but we'd be happy to go over the plans, send you the plans in your area, print out pages from that. But it really is just a wealth of information that we use. So it's just one of the tools that we use at the Senior Linkage Line. And there again, a referral can be made. The Senior Linkage Line does a lot more than just health insurance counseling. So we have a really important program called Return to Community. We have community living specialists that can come into your home to help you. We have a lot of calls of seniors that want to continue living at home. And so we have community living specialists that will come out, meet with you face-to-face, help you set up services, and just help you find just things that you would need to continue living there safely at home. So Senior Linkage Line is a lot of times is just known for health insurance counseling. We're always looking for volunteers. Marcy's a volunteer. She used to work with Central Minnesota Council on Aging. She's one of the volunteers at my table today. So we're always looking for people to sit at booths, at health fairs, just to get the word out that we're here, we're a free service, and it's still amazing how many people have never heard of us. So we just want you to know about us. So, Medicare, this is exciting stuff, Medicare. So let's just talk a little bit about open enrollment. I'm sure that many people already know open enrollment, October 15th to December 7th. This is a time that you can change your plans, and we'll go over the plan and or just a little bit about what you can change. But open enrollment, it's important for everybody to look at their plans. When you're on Medicare and you're on a plan, every year they have to send you a notice of what's changing in your plan. Perhaps you have a drug plan and one of your medications is no longer covered. So many times people get this information in the mail and they don't pay attention to it, or maybe it gets put in the trash. It's really important to look at the annual notice of changes, whether it's from your drug plan, your Advantage plan, because there's many things that change every year with these plans. Your premiums change, deductibles change, network providers change, the drugs on formulary change. Sometimes plans are offered in one area and no longer offered in that area or that county. So it's important to look at that and just review that on an annual basis. It is amazing to me to learn Kaiser Foundation came out with a study and said it's about 30% of people even look at changing or research changing their plan during open enrollment. So I have people that signed up for a $70 drug plan 20 years ago, 10, 15 years ago, and are still in that plan, and you can get a plan today for 50 cents. I mean, or next year. This year, $7.50 plan, I believe, was the cheapest drug plan. What I'm saying is it's so important to look at those changes every year, especially in the drug plans, and what they cover and the cost of them. We're going to talk a little bit about each one of these: Original Medicare, Medicare Advantage plans, and cost plans. I'm not going to spend a lot of time on cost plans because I'm guessing most people here don't live in one of the counties that the 21 counties that they're offered in. And we'll talk a little bit about each of these, but cost plans went away for the rest of the state in 2018. So the end of 2018, cost plans went away, and there's a whole nother story about cost plans. So to do your research, the easiest way is to use the Medicare.gov website. And I can't explain, this is a great place to start. It's not hard. If you use the computer, you put your zip code in there, and that then tells the site which county you live in. And then it will bring up all the plans offered in your county. So you don't have to see the other 100 plans out there. You're just going to be able to view the counties or the plans offered in your county. This is a great place to start because it kind of narrows your choices down. It narrows your choices down to the plans offered, and then from there, you can use this great guide of ours, and we'll talk about that a little bit later too, to kind of look at the summaries. Another thing is, if you don't have a computer, a lot of people just choose not to use one, don't know how to use one, that's okay. I'm a little technology challenged myself, so thank you to Chisago and the people that helped set this up, but I've been doing this for quite some time. I can help with setting up the plans. I can help with mailing out information to you about the plans offered in your area and doing a comparison for you. So we're going to talk a little bit about Medicare and Original Medicare. And I believe we start right here. So Medicare Part A has a monthly premium. This is Original Medicare. I'm not talking about Advantage plans. I'm not talking about drug plans, not talking about Medigap supplements. Original Medicare is only A and B. A lot of times people refer to it as inpatient hospitalization. It has much more than that, but here is the Part A, and the Part B is kind of everything else other than inpatient hospitalization and drug plan. So you can see A and B, hospital medical, does not include your drug plan. And I'm going to jump ahead a little bit. The government says you don't need to get a drug plan. It's just that if you don't get a drug plan, they'll penalize you when you do get a drug plan. So we just really encourage people, especially next year, since there's a 50-cent drug plan, to sign up for that Part D, which is the drug plan, standalone drug plan. Now, there are people that really don't have to do that. So that would be like our veterans. If you have drug coverage through the VA, that is considered creditable, so you wouldn't need a drug plan. I'm getting off on a tangent here. So I'm going to go back. The original Medicare. So this is Part A and B. I just want people to know that Part A is more than just inpatient hospital. It's also the part that pays for you to go to a nursing home for rehabilitation. It's also the part that covers your hospice. It's also the part that can cover some home health benefits. But generally, people refer to Part A as inpatient hospitalization and Part B as medical. You can see the premium. We got a break this year. The premium actually went down this year from last year. Next year, it's going up $10. So the premium so Part A, no premium. As long as you have 10 years of work history, you don't have to pay a premium for Part A. 40 quarters, 10 years, Social Security decides that. If you go in the hospital deductible is $1,600 this year. I believe it's going up to, and I'll just check because this is hot off the press, the hospital deductible is going up to $1,632 next year. Now, a lot of people think you pay that once a year. You pay that each time you go into the hospital. So, if you go into the hospital today, this is a bad example, we're at the end of the year, but if you don't have a 60-day break, you don't pay it again. So, for instance, you're sent home, they should have never sent you home that early, and you go back into the hospital 3 days later, you don't pay that deductible. But if there's a 60-day break, you do have to pay that $1,600 again, $1,632 next year. So it's each time you go into the hospital without a 60-day break. So, or hospital or nursing home. So just remember that original Medicare, that's going to be your cost. Now there's so much more of this, co-pays for hospital stays and lifetime reserve days, and I've been here 8-9 years. There's people that have been here 15 years. They've never run across it because they kick you out of the hospital right away. So it's important to know that, and also when I talked about skilled nursing, they do pay for you to go into the nursing home for rehabilitation because Medicare never pays for long-term care services. They do pay for short-term. So hip replacements, knee replacements, those are just the most common, I guess. If you go from a 3-day inpatient stay in the hospital to a nursing facility for rehabilitation, they will cover the first 20 days for free. They give you 20 days for rehabilitation without no copay. Days 21 through 100 are going to cost $204 per day. Now, people say that they'll call us and say, the nursing home says I have to pay after 10 days. And that's because you have to continue to meet the need. So I had a gentleman call. He wasn't participating in treatment. If you're not doing your PT, OT, and there's records showing that, Medicare's not going to pay. If you're not making progress, Medicare is not going to pay. So yes, that's out there, but it's kind of like everything we say has a little bit of an exception, and you have to meet that medical need. But just know that the nursing home is covered Skilled care is covered as long as it's short-term. And I did put some of the costs up here so you'll know what it is today and what it's going to. Now, Part A, Part B is kind of everything but the hospital, the inpatient hospital, the hospice, and that sort of thing. Part B is everything else except your drugs. It's your ambulance rides, your medical equipment, it's your outpatient surgery, it's your doctor visits, it's your ER, it's your urgent care. So that's why people incur most of their expenses with Medicare under Part B, because you're paying 20% of the allowed amount. You can see here, it has a monthly premium of $64.90 and $174.70 next year. It has an annual deductible. Unlike Part A, this has an annual deductible. It's going from $233 to $240. That means they're not going to pay a dime on your Part B services, except preventative care, some of those, until that $240 is met. Then they pay the 80%, you pay the 20%. So that's why a lot of people, they incur a lot of costs with Part B because they're paying that 20%. I should mention that those premiums that are put up there, the $164.90, it really does go on your income. And this is really hard to explain because Social Security figures this out, and I've never figured why they figure it out this way. If you're new to Medicare and you enroll in Medicare, your premium this year was $164.90. But if you have an income higher, it's called an IRMAA, it's an income-related monthly adjustment. Social Security says if you have a higher income, and I believe it's over $97,000 and as a couple over $194,000 of adjusted gross income from 2 years ago. So if I'm new to Medicare in 2023, they're going to look at my tax statements from 2021 and they're going to figure out what my premium is going to be. For most people, and you can see, there's only 8% in the entire nation that have that IRMA attached. So there's only it's under 10% pay that extra amount for their premium. All right. And so that's original Medicare, and there are a lot of changes that have come with Medicare, actually good changes. One of the biggest changes that was made was general enrollment period. So if you missed your general enrollment period, to understand this easier, I'm going to give you the veteran that called me. The veteran wanted to enroll in Medicare. This was in July, a couple years ago. And he desperately needed a surgery. I'm not sure why the VA wouldn't cover it, Medicare would. So he called us, and then I had to tell him, oh, you never enrolled in Medicare 5 years ago when you should have at age 65, and now you have to wait till January 1st through March 31st to enroll because that's general enrollment period. And in the old days, before this year, then his Medicare wouldn't start until the following July. So that gentleman waited a year for his Medicare to start, even though he enrolled in January for his Part B service, for his Medicare, because the old rule said that if you enrolled during general enrollment period, you missed your initial enrollment when you turned 65, they kind of penalized you, made you wait another 6-7 months. Now, when you enroll during general enrollment period, which is January 1st through March 31st, for those people that missed their enrollment period, now it starts the first of the following month. And that's a pretty new rule. And that was a huge change for this year. And then in 2024, during the enrollment period, there were some other changes if you have a special enrollment period. You have, and this is going to get complicated, so You can read the slide, but I'd rather you call Senior Linkage. There are 20-some special enrollment periods. If you end up no longer working and you had health insurance through your employer, if you moved, if you're living in a nursing home. So there's so many different special enrollment periods and there's so many different rules. I don't want to give a blanket rule, but just know that other than that initial enrollment period when you turn 65, there are other reasons in special enrollment periods that you may be eligible for. So please give us a call if you have any questions about a special enrollment period. This year, beginning in 2023, there was a new special enrollment period allowed, and it was related to circumstances beyond our control, i.e., COVID did a lot of things to us. There was also emergencies, natural disasters. So if you ever experienced one of these, Medicare or Social Security may allow you to enroll during a special enrollment period. And then again, starting in 2024, so starting next year, you'll have a special enrollment period to get into an Advantage plan or Part D plan if you enrolled because of one of those exceptional special enrollment periods. So I won't go over that too much. Again, there's so much to remember there, but I do want to touch on this. I don't know if it affects anybody, but during COVID, there was a rule made that nobody on a medical assistance program, and this included Minnesota Care, medical assistance in all its programs, no case could be closed. There are people on medical assistance, sometimes 3 and 4 years, that never were recertified. During that time, they became either over the income guidelines, maybe over the resource. I had a lady inherit $500,000. So at any other time, they wouldn't be eligible for medical assistance, but they continued to have those cases open, and now we are at the unwinding period. That means that people now have to recertify. They're no longer eligible for medical assistance and maybe all those benefits that they got, and it's pretty devastating because they've been on it for 3 to 4 years. If you have any questions about the renewal process, because I know this doesn't affect everybody, but it's become so complicated, because instead of kicking everybody off at once, they decided, and rightfully so, that they would wait until somebody's in recertification period came up, so they didn't have this mass exodus of people that were kicked off of medical assistance in their programs. So those people are kind of just being phased each time now when their recertification period comes up. The people on any of these programs, and there's a lot of different programs, but you can see some of them here, they're being recertified. And if you have any questions about that, please see us at the table out here too. There's been a lot of questions about COVID and how to get tests, and it's still happening, we realize that. But Medicare is no longer covering the over-the-counter tests. Medicare does, Part B does cover the lab tests for COVID-19. Medical assistance will continue to pay for the over-the-counter tests. But I just want everybody to know, if you go to Minnesota Department of Health, or if you want us to help you do it, you can still get free tests. So you don't have to go through Medicare. But it brings up a couple thoughts, because during COVID, we had so much fraud and scams happening where they would call Medicare beneficiaries and say, I need your Medicare number so I can send you free tests. So again, just remember, like, Medicare will never call you. It's kind of like the IRS calling you, right? IRS will never call you. Medicare will never call you. Social Security will never call you. Now, they do call people. Social Security does call people if you've made an appointment, obviously, with them, and they do have phone appointments. But we had a lot of fraud during this time of collecting Social Security numbers and Medicare numbers and things like that. So just wanted you to know about that. Okay, and we are already to Part D. So let's talk a little bit about Part D. And I really strongly feel that a lot of people could save a lot of money if they knew more about drug plans. And whether you get your drug plan with your Advantage plan, whether you have a standalone drug plan, I just want you to know about the drug plans. There's been a lot of changes, and there's a lot of changes coming. So again, the coverage is optional, right? But you're penalized if you don't have one. And plans that offer Part D include standalone prescription drug plans. And next year, they range from 50 cents, lowest plan we've ever had in 10 years, to $123.50. Here's the sad part. For many people, if you're on low or pretty cheap, common, generic medications, blood pressure, blood thinner, things like that, a lot of times you will pay the same at the pharmacy with the 50-cent plan that you'll pay with the $123 plan. And people tend to think if they pay more money for their drug plan, they're going to pay less at the pharmacy. And sometimes that's true. Sometimes those more expensive plans are for the people that maybe have a list of 20 or 30 meds, and they want one plan that covers all those, and maybe they take 2 different insulins or 2 different inhalers. And so the more you pay, the greater the chance that that more expensive drug plan will have more drugs on formulary. But for most of the people that I meet with, it's not the case. Most people can get by with the lesser costing plans. So the annual plan changes, again, include the restrictions. They include different pharmacies. They include different premiums, different deductibles, things like that. So paying attention when you get that notice in the mail, the annual notice of change, they call it the ANOC, that you pay attention to those things that are changing for next year. In 2024, you'll continue to see changes to improve coverage. This gets really complicated to kind of explain the process of what the drug plans and how much you pay. But if you reach the catastrophic phase in 2024, you will pay nothing for your drugs that are on formulary. Sounds really great, right? The problem is the catastrophic phase, and I'm looking for it, it's over $7,000. What happens to people once you're in the catastrophic phase, you can't afford the medications. So that's when we get called and say, are there any ways you can help me to afford these expensive medications? And we can. There's drug manufacturer programs, there's copay assistance programs, and I never knew these existed. So there are, we're hopeful that we can help you if you ever reach that catastrophic phase. You know, a lot of people are looking for that help in the donut hole or the coverage gap. And again, I'll kind of go through all those, but just know that there are changes coming, and the changes are really great for the years to come in 2024 and 2025. So this just kind of tells you, so your drug deductible for next year might be $545. After that's met, you'll pay 25% or less, depending on the pharmacy that you go to. Once you hit the donut hole or the coverage gap, $5,030, that's what you and your plan have paid together for your medications. Then you'll pay 25%, and that gets really expensive for those costly meds out there. What you can't see with this graph, and here's the reason to give us a call, or please do your comparisons online. Because if you take some of those cheaper medications, those really common ones, they don't even apply the deductible. A lot of the plans say, if you take a drug that's on a tier level 1 or 2, atorvastatin is it for an example. If you take a drug on a tier 1 or 2, we're not going to apply the deductible at all. So you're not even going to have to satisfy that before we pay for your medication. And your copays could be $1, your copays could be $3, depending on what pharmacy you go to. Another reason to use Medicare.gov. I just can't emphasize that enough to be able to use the tools available to look to see which plan's going to be the least costly for you for next year. And the catastrophic phase is $8,000 now. So once you reach $8,000 out of your own pot, then woohoo, your meds are covered. But usually nobody can afford that. So that's why they call us, usually when somebody's in the coverage gap or the donut hole, it's referred to that. Another thing that changed for 2024, there is a program called the Extra Help Program through the Social Security Administration. It's a program that saves people thousands of dollars a year, and people don't even know sometimes they're eligible for that program. You do have to qualify with income and resource eligibility limits, but starting next year, you can be above 150% above federal poverty level and still qualify for that program. What it does is those medicines that are hundreds of dollars now become $4 or $11. $11 for the brand name, $4.50, and don't quote me on those, but you can see where some of those really expensive drugs like Jardiance or Xarelto, I always say the ones that you see on TV, those are the most expensive. And so that's what helps people, and it used to be you could only be above 100% above federal poverty level to be eligible for that program, but now you can be up to 150%. And again, those people that had partial this year will automatically go to full next year. And we've been told no questions asked until your recertification comes up for that program. And I don't want to spend a lot of time on this just because some people aren't eligible. But if you are eligible for that Extra Help program, you even get a free drug plan. You don't have to pay anything for your premium. So I would just encourage people to stop by the table, just at least ask if you might be eligible for that program. Again, you can say, well, here's the $450 and $1120. So here's the amounts that you would pay. And if you're 100%, you pay less. If you're more than that, you pay a little bit more for your medications. But imagine being able to get a medication that costs $1,000 a month for $11.20. So I believe they came out and stated that as an average, as a whole, saves people $5,000 a year. So it's huge that people know about the Extra Help program. Again, it's a program offered by Social Security. We can do the application with you right over the phone. You can do an application with Social Security right over the phone, and we'll fill it out for you. Then when Social Security gets it, and I've had them process them within a month. So if you're new to Medicare, I would encourage you to look at that, make sure that you are or you're not eligible for that program because it saves people so much money. Okay, and I said there was a lot of changes coming for Part D, and here are some of those changes. So it talks about the Inflation Reduction Act, the IRA of 2022. Here's some of the things it did. Hugest thing that happened this year, everybody's insulin was capped at $35. So let me explain that, because probably most of the people I see, two of the most expensive things are their inhalers and their insulin. This year, for the first time, your insulin is capped at $35, but make sure your insulin is on the drug plan's formulary, meaning they cover that insulin. I know I've had some problems with like Novolin N, Novolin R. Those are kind of older insulins. And so, yes, your insulin is capped as long as that insulin is on the drug's formulary. Again, maybe just to point out, because I don't want anybody to have the wrong information, $35 a fill. So if you get your insulin 3 months, it's $35 each of those for each fill. So Just know that it's capped. That was a huge change for this year. And then there's just some other changes. Of course, probably one of the biggest ones that now all the vaccines are covered under Part D. That's wonderful. So shingles and the COVID vaccine, and all those are covered under your Part D, as in dog plan. And there's some other, and these are kind of a little over my head, but drug manufacturers are required to pay the government rebates if Part B or D drugs price increase faster than the rate of inflation. And there's some other things with that law that were passed. And here's, you can kind of see, this is the greatest thing that I've seen since I've been here. $2,000 cap on all meds. Yay. It's been a long time coming, and you still have to wait till 2025, but that means, you know, that donut hole and all that stuff is going away, and there is a flat $2,000 cap on medications. That's a wonderful thing to come. So, like I said, there has been some great changes, some great things coming. Some of them have already gotten here, not all of them. The other thing, and I just find somebody's going to find this interesting, that the federal government will be allowed in 2026 to negotiate 10 drugs. And I thought this is interesting because I get so many calls about these 10 drugs. And it's because these 10 drugs were selected because they cost over $50 billion of the Part D covered. Let me say that again. These were selected as the cost was over $50 billion total for the Part D gross covered prescription drugs for Medicare. So they were the most costly, and they took that information from June 1st of 2022 to May 31st of 2023, and the 10 drugs are Jardiance, Xarelto, Januvia, I'm going to say this wrong, Farxiga, Entresto, Embro, Embrovic, I can't say it, Imbruvica. I should have practiced my pronunciation. Stelara and Fiasp, which includes the pens. It's a flex pen and a pen fill for Fiasp. That's huge when you think of $50 billion, just those 10 drugs. So I think Medicare is getting wise, the government's getting wise that the cost of medications are out of control. And this act or this timeline is how hopefully we're going to help settle that. Now, I feel like I've gone a little bit backwards because I want to talk about Advantage Plan. We talked about original Medicare. We talked that everybody needs a drug plan, right? And whether you get that drug plan as a standalone drug plan, Part D, or whether you get it in with your Advantage Plan, it doesn't matter. You have a drug plan. But I want to talk about Advantage Plans. People get very confused about this. And here's the reason. I don't like to call them supplements. They're really not supplements. Advantage Plan is a Medicare replacement plan. So if you enroll in an Advantage Plan, they also are known as a Part C. It combines all your benefits under Part A, Part B, and Part D. And it's all under one plan called Part C, called an Advantage Plan. And what you've done now is you've picked a private company. Big ones are Humana, UCare, Blue Cross, United Healthcare, Health Partners, Medica. These are Minnesota ones. But you've now decided to take a private company that's going to take over your federal benefits of original Medicare through the federal government, and now these companies, these private companies, have become your Medicare payer. They're the payer on all your claims, all your medical, all your hospital claims, all your drug claims. So, and it's not right or wrong, I just want people to understand that really now the federal government's not in control of the payer. You now have a private company as your payer source for all your Medicare benefits. By doing that, the Advantage plans can offer extra benefits to you, like vision, dental, and hearing. And those are probably the best things that people can get through Advantage plans, because it's the few things that Medicare doesn't cover. And every time I say that, I always say Medicare doesn't cover anything of the head, so that's an easy way to look at it. But there's always exceptions with that too. So Medicare obviously does cover for cataract surgery. They do cover for a pair of glasses after cataract surgery. I had a gentleman that I met with that Medicare covered for the extraction of teeth of his jaw because he had cancer of the jaw. But of course they didn't cover dentures or implants or anything else. So just know, sometimes there's a little bit of an exception to a rule, but as a rule, Medicare doesn't cover vision, dental, or hearing. And that's probably one of the biggest reasons people like Advantage plans, is because they can get some of those and they also get some other perks too. So some of them, you can get over-the-counter medications. They have an allowance every quarter or every year to get vitamins or anything over-the-counter. They've gotten really creative. Some of them offer fitness benefits. Some of them offer discounts on community ed classes. So they do offer extra benefits, and in doing so, now you have agreed, and I've kind of gotten off on the slide again, I do these tangent things, but you've now agreed to stay in their provider network. And we're going to talk a little bit more about it, but they just want you to know on this slide that it's open enrollment time. If you have an Advantage plan, here's the time to look at all the other Advantage plans offered out there. You can change your plan. You can go back to original Medicare and just get a drug plan. And what they finally did, everything seems like when you're this age, everything seems like a few years ago, but it was probably 5 years ago. The one great thing the government did was there were so many people calling off those commercials off TV, not knowing what they were enrolling into. Then they would enroll in a plan that they couldn't go to their doctor they had seen for 20 years, or they couldn't go to the pharmacy down the road because it was a mom and pop pharmacy and that Advantage plan didn't have them in network. So one of the greatest things they did is, if at open enrollment, if you don't learn anything else from this, during an open enrollment, you can change your plan. But guess what? You have another chance to change your plan. If you enroll in an Advantage plan during open enrollment, which is now, October 15th to December 7th, you can do all these things, but you have another chance January 1st through March 31st. It's called the Advantage Open Enrollment Period. Medicare got so many complaints from people that had no idea. The companies were cold calling them, and we're going to talk about that. That's why I got to hurry here. But they had so many cold calls, so many things in the mail. People didn't realize what they were signing up for. They'd get in this plan, and it wasn't anything what they thought it was. And so the Medicare, the government opened a whole other period after open enrollment that you actually can change your plan again. So right now, if I change my plan for January 1st next year, and I learn by February 1st that I really hate that plan, I can change it again. And then that new plan would be effective the first of the following month. So again, getting ahead of myself a little bit, I just want you to know everything that you can do. Here are some things, and I'm not going to read all these to you because I want to have time for questions. I just want you to know that there are some things coming down the pike of things they can and cannot do. This marketing thing. In fact, my volunteer brought this into me this morning, said, look what I got. So this is it's just a company, it's a private company offering that there are plans in your area that you can have up to $5,000 in comprehensive dental and $3,900 off your rent. I mean, I looked through my entire healthcare choices book. There's no plan that has a $5,000 dental. So what happens is they'll send these out, but these are nationwide companies. So these plans aren't even offered in our area, but they get you on the phone, and then they maybe talk you into something else. So that's how they make their money. And I'm not faulting, yikes, if anybody works for one of those, but I'm not faulting these companies. That's how they make their money, is to enroll you into their plan. They get a commission. So it's just be very leery of the information that you get. And please use the resources. Use senior linkage, use Medicare.gov, but they had so many complaints, like the J.J. Walker and the Joe Namath commercials, right? Everybody's familiar with that. So now they have to put a disclaimer on there also. And let me go to the next slide. But we're kind of figuring this, out, sorry. So they have to limit their advertisement. These companies can't cold call you. However, if you've answered the postcard, if you've called them, if you already have a plan with them, they can call you and offer you other plans, but these companies are not supposed to cold call you, and it's still happening. So you can see just some of the, and I can print these slides off to anybody that wants to read through some of these, but I'm getting limited on my time because I talk too much. So here's some other things. They're supposed to explain the effect of enrolling. Medical benefits must be listed in specific order. And there's a whole array of things here that now they're supposed to do. It was kind of funny because this year they came out with those commercials you see on TV. They're supposed to have a disclaimer on them saying, these plans, these services may not be offered in your area. And it's about this big, so you can't see it, right? And so we realize that, and I think the government's working on that. Another thing that we just wanted to touch on is in 2024, Medicare Advantage plans must give you the same access, medically necessary care that you got with original Medicare. We do have people on Advantage plans that have called and said, wait a minute, my Advantage plan isn't covering this item and it's covered by Medicare. Technically, yes. They have to cover the same things that original Medicare covers. They can do it in a different way, right? So let me give you probably one of the biggest examples is with original Medicare, you have to have a 3-night overnight stay in a hospital to go to a nursing home for rehab. If you have an Advantage plan, they don't care. They don't care if you've been there 1 day, 2 days. They don't care if you've been there overnight. Most of the Advantage plans, I believe, have done away with the 3-day hospital stay. But they have a team of medical professionals. They're going to look at your case and see if you're worthy for that stay. So yes, they have to cover the same things that Medicare covers, but they can do it in a different way. Again, I'm just going to kind of breeze through these. I'm not going to spend a lot of time. We kind of talked about Advantage plans, drug plans. I'm not going to spend a lot of time on cost plans. Is there anybody here from Mille Lacs or Pine? And I'll certainly be happy to talk to you out there. People love their cost plans in Minnesota. 2018, they went away. People are devastated. They are kind of like an Advantage plan, but people loved them. They felt they got more services for less money. They could change. They could step up. So if they got a cost plan with a company that was $30 and they knew they were having surgery in 2 months, they could bump up to the $100 plan. These are great. People love these plans. They went away for everybody in the nation, end of 2018, but 21 counties in Minnesota. And every year, for years and years and years, they kept saying, they're going to go away, they're going to go away. They're still here. So we're not sure why, but there are 21 counties in Minnesota. You still can get a cost plan. And if anybody has questions, I'd like to talk to them about that. I just want time for questions at the end of this. Again, we talked about fraud, scams. We are senior linkage line. We do also have, we're Senior Medicare Patrol. We fill out reports when we get scam, fraud calls. We send them to you to sign, send them back to us, and then we do send them to Medicare. So you certainly can call us, and we'll kind of walk you through that. And one thing I probably didn't touch on is Medigap supplements. And those are very unique. Those are really the only type of supplements, even though we all call every plan that we enroll in that's not original Medicare a supplement. A Medigap plan is a true supplement to Medicare. That means Medicare pays first, the supplement pays second. And those are very unique plans. You kind of have to get them when you're new to Medicare, otherwise you have to go through a health screening. They're pretty expensive plans. We kind of call them the Cadillac plans because, of course, you can go anywhere in the nation. They have some emergency foreign travel out of the U.S. coverage. They have no network of providers. So those plans cost more. People tend to stay in those plans once they sign up for them. You don't have to. But if you ever want to get back into it after dropping it, you'll have to go through a health screening, and they have the right to deny you. So if you have any questions, I'd be happy to take questions. Yes, I'm with Senior Linkage Line, which covers all the counties in Minnesota, but I'm actually with Central Minnesota Council on Aging. Our home office is in St. Cloud. Senior Linkage Line is broken up into 6 different regions. So there's Minnesota River, Arrowhead. But yes, I am on the Senior Linkage Line. It covers all counties. Reduced. So yes, that's a good point. If somebody's made a lot larger income 2 years ago, please appeal that. It doesn't cost you anything. Yeah. Oh, I'm sorry. The IRMAA, so the income-related monthly adjustment that Social Security charges you because you made a higher income when you're new to Medicare to figure out your Medicare premium. They look at your income of 2 years ago and they decide what your premium is going to be. Now, for most people, it's that $164.90 that's going up $10 next year. But there are certain circumstances where if I retired a year ago and they're looking at my taxes from 2 years ago, of course I don't make anywhere near the money I made 2 years ago. And so you do have the right to appeal if they charge you more for your Medicare premium. Does anybody else have any other questions? Yeah. Good question. With original Medicare, you're not covered out of the country, period. However, there's an exception. If the closest hospital is in the U.S., that is a difficult question to answer because there is a little bit of an exception with Medicare, but you have to be a certain distance. You have to be closer to the U.S. hospital and all that good stuff. Now, the Advantage plans do have travel coverage, but be very careful in reading what their travel coverage is, because a lot of times if you go out of the network, there may not be an in-network provider in another state that you're going to. They all have travel benefits. They all work differently in what they cover, but I would say for the most part, Advantage plans are more difficult to use if you travel. They'll say they have travel coverage, and that came about because we had a lot of snowbirds that would never enroll in Advantage plans. A lot of them went to Texas or Arizona, lucky. But so Advantage plans became very creative in their travel benefits, and they're all different. Some of them don't have travel, some of them don't have any participating providers out of the state of Minnesota. So just be careful, read the Advantage plan information. The Medigap supplement is the only true insurance that will cover you out of the U.S. In fact, if you get a Medigap supplement, and they're more expensive, they usually start around $200 and up, they'll actually cover you out of the country. And they'll cover you at 80%. And those are a whole different breed, but again, you know, they have the most flexibility, they have the most coverage, and you pay for it. So, an easy way to explain this, it's kind of, you get what you pay for. If you have a $0 Advantage plan, obviously your co-pays when you go to the hospital, when you go to the doctor, when you ride in the ambulance, when you get medical equipment, is going to be higher than the plan that I pay $90 a month for, or the plan that I pay $150 for. Let me tell you a really easy way to tell. The cheaper plans, when you go in the hospital, you pay per day. So it may say something like, you're going to pay $150 a day for the first 6 days, or it might be $450 a day for the first 6 days. If you get a plan, that's a $0 plan. If you get a plan over here that maybe costs $90 to $150 a month, your hospital coverage is going to say per stay. So it's not per day. It might be a flat fee of $200 per stay. Doesn't matter if you're in there 1 day or if you're in there 10 days. You pay per stay instead of the cheaper plan that's per day. Another way, $0 plans, or those plans that are $20 maybe, you'll see if you look at the benefit summary, you'll see a lot of them are percentages. So if you ride in an ambulance, you pay 10% or 15%. But if you get one of these plans over here, that's a middle to a higher costing plan, you'll see you'll have an actual copay of $200 when you ride in the ambulance. Doesn't matter if it's ground or air ambulance. So if you look at the fine print and the summaries, a lot of the things are the same, like the lab might be covered in full. MRIs are a good one. The cheaper plans, you pay a percentage on your MRI usually. The more expensive plan, or the middle of the road plans to the expensive, you might have a flat fee of $200 to pay for an MRI. It's kind of like everything else, right? Car insurance, you have a cheaper premium, you know, you'll get less coverage. So, and that's okay for some people. I mean, some people say, I can save a lot of money by a $0 plan. I get my drug plan for free. I don't care that I have to pay 20%. I get vision, dental, and hearing. I get some preventative care with that. So that's why it's so different for everybody. But that's what I always tell people. First of all, you know, maybe everybody'd like the Cadillac plan, but we can only afford what we can afford. So you have to be comfortable with the premium that you're going to pay. But as a rule of thumb, the less you pay for a premium each month, the more you have in co-pays when you use that. Does that kind of answer the question? I'm guessing, he's shaking his head. Now, there are plans that have different levels, you're right. So let me just take UCare, for example. UCare Essential, UCare Complete, UCare Classic, UCare. I mean, there's one carrier that could have 6 different Advantage plans, and they could cost from $0 to $200. Medicare.gov, you can compare up to 3 plans at a time, side by side, and you can just go right across. This plan covers hospitalization. I have to pay $100 a day. This one says $100 per stay. Yes, you can take 3 plans and compare them side by side, and they'll go down each benefit. I mean, of the, their evidence of coverage book are hundreds of pages. So if you want to get into the nitty-gritty, like maybe one of them says, yes, we have comprehensive dental. But if you really want to dig into what that covers for a tooth extraction or a root canal, you'd have to go to the site of that plan. And they have what's known as, it's either an evidence of coverage, summary of benefits, and they're usually about 300 pages, 150, 200. You can actually find how much would I pay for a root canal, how much would I pay for dentures. So yes, you can compare them side by side. You can also use the Minnesota Healthcare Choices book, which is this guide. It's also online, but this is put out by the Board of Aging every year. This is the new one. And once you've got those comparisons on Medicare.gov and you've kind of narrowed it down to 3 plans, 6 plans, whatever it is, You can go in here, and each plan has a one-page summary that you can look at. And honestly, this is my Bible. This is my guide. If somebody says, I'm looking at this health partner plan, can you tell me a little bit about it? I can go right down that summary and I can tell them exactly what their copays are going to be. There's a 2023 guide and a 2024. Now, the 2024 should come up automatically, but just be sure you're on the right one. The answer to that question is you can look at them October 1st, but the information isn't guaranteed until open enrollment starts. All right. Thank you for coming. Please stop by our table if you have any questions. Thank you again for coming. Bye-bye.